Available in posterior and anterior options, patients can enjoy extended periods of comfortable walking with the M2 AFO's lightweight, durable design. This video contains orthosis fitting instructions for clinicians to assist with sizing, in addition to information for use at home. To identify the appropriate size of the M2 AFO, a clinician will measure the length of the patient's foot. This can be done by removing the insole from the patient's shoe and measuring its length. If the insole is not available, the patient's foot can be traced on a piece of paper. Sizing information for length and height can be found on Aspen's website. To mark the footplate to the appropriate size, the insole can be used to trace over the footplate. If the insole is not available, the foot can be traced to help guide the customization. Excess material can be trimmed away with scissors, and sandpaper can be used to smooth any rough edges. If necessary, the straps on the orthosis can be trimmed with scissors as well. Remove the tab from the strap, trim to the desired length, and reapply the tab. Please note, when trimming the footplate of the anterior M2 AFO, the location of the patient's shin relative to the footplate should be taken into consideration. The anterior shell should be comfortable when applied. If the toe area is too long, the anterior shell could sit too far back, placing more pressure on the patient's shin and causing discomfort. If this happens, trimming more of the toe area would help to position the AFO more comfortably. Conversely, if there is gapping between the shin and the AFO, the heel may be trimmed to allow the AFO to shift posteriorly in the shoe, reducing the gap with the shin. To apply the M2 AFO, ensure the insole is removed from the appropriate shoe. Insert the orthosis into the shoe, then replace the insole. Ensure the straps are open and ready for application. Then step into the shoe. Wrap the straps around the leg and the orthosis. Then press down on the hook and loop to secure. Clinicians should ensure the M2 AFO is not in contact with any bony prominences and is comfortable for the patient. The orthosis should be adjusted as needed. For optimum results, the M2 AFO should stay in position and not move up or down while the patient is walking around. Clinicians should always determine proper adjustment and wear time. The patient must be sitting down to properly remove the brace. To remove the M2 AFO, loosen the straps and step out of the shoe. Leave the M2 AFO in the shoe for easy reapplication. To change shoes, simply remove the AFO and place in the new shoe. Then repeat the application steps. The M2 AFO can be hand washed and air dried. Pads can be removed from the frame by pulling the hook and loop apart. Replacement pads are available online at aspenmp.com. Clean the padding with mild soap and water. Rinse thoroughly and air dry. To clean the frame, wipe down with a damp cloth and allow to air dry. Remember to place the pads back onto the frame before applying the brace. For more information regarding the M2 AFO, please visit aspenmp.com.